When Joseph AKON was shot in a battle in South Sudan Civil War 5 years ago, he thought he would recover after surgery. But his wound was so serious, his leg was amputated. That made it difficult for him to find a job, and for a while, he thought his life was over.
I was a soldier, and in one of the battles in Bentui, I got shot. When I lost my leg, I couldn't eat. I stressed out a lot. I couldn't be a soldier, and no one wanted to hire me for a job.
South Sudan seceded from Sudan in 2011 after 21 years of civil war, the longest on the African continent. But 2 years after independence, civil war broke out there too. Decades of fighting has left many people suffering from war injuries, both civilians and soldiers. It's also left hundreds of thousands disabled. Conflict has left many of those struggling to get the health care they need, especially in areas outside the capital. And some say they're marginalized and sometimes excluded from employment. In 2017, groups like Human Rights Watch estimated that South Sudan has about 1.2 million people with disabilities. That's largely the result of not just the recent conflict, but decades of violence. This center in the capital, Juba, covers more than half the country when it comes to providing care for the disabled. And those receiving attention say getting prosthetics or any other kind of services provides them an opportunity to restart their lives again. Susan Ide is 40 years old and has suffered from polio since she was a child.
Life is hard. Even though I try to work, still I need somebody to assist me. And people will fed up, even the family. But after I get the new device, I'm able to carry my books and everything, my materials, school requirement and everything. I work with my own without any support.
The center produces prosthetic limbs and other aids, including wheelchairs. Doctors here say while there's less fighting in South Sudan as a result of a peace deal signed in 2018, many patients continue to come for help.
The biggest group, these are the group of gunshots, and we have like animal bites, they are there, snake bites, and now we have the diabetic patient. As I talk now, the rate is increasing.
Staff here say if conditions improve in the country, they expect the number of patients in need of rehabilitation to rise.
But at this moment, the center capacity is fully occupied with the patients, and we are somehow managing. We don't have much waiting list. But once the access is improved, the road condition is improved, the public transportation improved, then there are many patients who are not coming, they will keep coming. Then we will have really challenges to handle.
Joseph says he's yet to find a job, but he says now that he can walk again, he doesn't feel stigmatized and left out. And that's giving him hope that someday he can work again and financially be able to stand on his feet. Hiba, Aljazeera, Juba.